Hello and welcome to this interaction with our guest, Dr. Sachin V. Desai. I'm Archisman Mohapatra and I have my colleague Dr. Kavita. Both of us are from Grid Council. And to introduce our guest, Dr. Sachin V. Desai. Dr. Desai is an associate professor in the Department of Community Medicine at SN Medical College and HSK Hospital and RC, Bagalkot, Karnataka. And he has an additional qualification in public health nutrition and is about to complete his MSc in Dementia Studies from University of Stirling, Scotland. This has been out of a Commonwealth scholarship. He has been an awarded fellow by the Geriatrics Society of India and also by the IMA Academy of Advanced Specialities. Has multiple publications, especially on preventive geriatrics. Welcome, sir. Thank you so much for obliging us with this interaction. For our audience, I just came across this book, and it's titled Healthy Aging in a Changing World, a practical and clinical guide for awakened aging. Now, this book is interesting because it has two sections. The first one goes a bit deep into public health issues related to aging in our country and touches upon many sociological issues as well. The second part is clinical, in which they have taken up multiple issues related to the elderly population, but to something that can be interpreted and really implemented at the home level. And I was quite excited to browse through the book, and then I discovered that okay, we have Dr. Sachin, who is the co-author of this book. So I invited him for this interaction, and that's why we are all together.
Thank you.
Right.
Thank you, Dr. Archisman, and thank you, Kavita ma'am.
Right. So, Dr. Sachin, what is the basic philosophy behind this book?
So, majority of the Indians are in the impression that whatever changes that occur in the senior citizens is because it's an aging process. It's just a normal phenomena that everyone has to go through. But in this day, where science has advanced into advancements in such a manner that where you could view tissues to as at the microscopic level, and you could also identify what's happening inside. Why not pick these symptoms earlier? So, and it's a book where we compile all the clinical and as well as practical aspects of aging. And when we all authors, when we all when all contributors were asked to write in a simple language, we were able to address various issues that the elderly would go through. May it be the social aspects, may it be the clinical aspects, may it be the newer advances that they need to go through, or maybe they need to adopt to have a graceful aging. This was an inception, got into inception a year ago, just at the time of COVID, when I happened to discuss this with my senior colleague, and we decided to put it down in as a compilation. So basically, it was just out of a discussion that it emerged, and seeing it was actually I did put forth this. This idea was basically long ago when we did as a first MBBS student, when I was pursuing my MBBS, just joined the MBBS, and it happened that at my place there were similar symptoms of Alzheimer's which was seen in my grandparents. And at that moment, I didn't have a ready reckoner book or a compilation that I could refer. I did go to the internet, but I did find only pharmacological interventions. So it was just in mind, in the back of my mind, long then. But it took as days evolved, and we did get an opportunity to put it across. And also, when I was pursuing my PG diploma in geriatric medicine, it was that I was able to see as many as senior citizens going through the similar phase. So when I got this opportunity, I thought we can pen it down and may it reach the unreached population. With that intention, we did put this across. We put these topics. I did request all the individuals of their respective specialties, and it was also I did receive guidance from Dr. Naduja, Dr. P. Shankar, who did help me in putting them in the right order and just advising me at timely levels. So the only intention was what I did face during my early MBBS days. as not having a reference or maybe a guide to understand the symptoms. I thought let not others have that face that difficulty. So I turned this event of not having an access into an opportunity and got this to put it across. It took around it was maybe in 2002 or 3 that I was in my first MBBS days. It's now 2021, so maybe it took a long time to, but the idea was there, and maybe it's now is the time to, and I got an opportunity to put it across. So
But
basically, to reach the unreached and address the senior citizens, not as an aging process, but also to identify them and put them across.
when I looked into the book, content is quite contemporary. Parents staying alone with no one to care for, caregiver burden, caring for the elderly, and management of loneliness in the elderly. Uh, how do you see this different? Is there a different lens when you look at urban India versus rural India, or a
Absolutely,
bit of a transition?
absolutely. So when we see rural India, it's a well-knit society there, and there is a joint family system there. So basically, this joint family would act as a shock absorber, maybe in caregiving, maybe in stress management, maybe in loneliness management. So they are well equipped, being large number of members in the family. So when they are well knit, and it's a society where people are supporting each other, maybe from a child or a youngster to a senior citizen, each one are sharing the responsibility of the household, being a shock absorber for the stress levels, and also being a ray of hope if one person is low or being depressed. When they see a child with the enthusiasm, with the smile or the cheerfulness, the senior citizens' mood may vary. So just the interactions or the intergenerational engagement would definitely bring about changes in the rural India. But in an urban India, what do we see here? In a quest to build a better future or a better career, they would definitely migrate, leaving their origin to a modern society, to an urban area where there's just one or two individuals. Maybe it's their son or their daughter-in-law. Uh, there would be a lot of caregiver burden or strain. The senior citizen who is at home would experience this loneliness because nobody is there at home. And when the working child or the son or the daughter would come back from work, they would experience more burden because they would have to manage dual responsibility. So hence, in the nuclear families, so where we are in a modern, it's very difficult to address the dual responsibility which the individual would want to take up. It's maybe with relation to running the family or maybe caretaking or caregiving, which would lead to burnout and definitely stress in the caregivers.
Dr. Kavita, you have been to rural Haryana for some community work in the elderly.
Yeah.
Uh, you have some primary experience regarding the
Yes.
elderly.
Yes. So as far as psychosocial support and support of the family members is concerned, I feel yes that the rural India has an advantage. But what I would definitely feel is that there are some issues with respect to care seeking, or even seeking healthcare in terms of when people have stroke, or all those kinds of situation, because we have seen in the villages where people don't go to the don't go to the healthcare system for all these things. So how are we going to, that is one difference which I see in healthcare seeking.
Yeah, there is a huge gap in care seeking as well when we look at rural India, and multimorbidity is a big problem. Uh, how do you see the public health systems addressing this challenge, Dr.
So
Sachin?
yeah, now that the wellness clinics are on their way and they are being implemented in the most basic unit of the hierarchy of healthcare delivery. So when maybe in the urban health center or urban primary health centers, so when we are and now that the geriatric and the national health programs related to the elderly are more connected and more addressing more of the elderly, what we can do is right from the basic, like getting a number, getting their details, social demographic details, having a registry, monitoring them over a period of time would definitely have a benefit. Now, addressing these health issues would be like more of a like providing them, like equipping the primary health center, or appropriate referral, quick referral, early diagnosis would be the important aspect. So picking up the signs early and identifying them earlier and quick referral could save time. Uh, I totally agree regarding the complicated cases and related to emergencies. It will be a very difficult task because the infrastructure or maybe the healthcare wouldn't be that equipped. But uh, if they are having multiple morbidities or risk factors, screening them, tracking them, and monitoring them would definitely uh, pick the signs early and send them. So what I tried to do here in this book was write it in a simple language, may it be a practical guide or a clinical guide. So the clinical guide had all the symptoms of any morbidity, right from the oral cavity, the eye, ENT, to the cancers and osteoporosis and the physiological and even cancers. So what was the idea behind this was, if the caregiver could understand when to identify the symptoms or just the one or two early signs, it's basically to educate the person who is a bit literate, maybe the elderly, maybe the caregiver, so that they can quickly access or reach the place before a complicated situation arises. So, with that intention, this book was compiled, and the social issues also has certain newer technology or maybe related to current technology or non-pharmacological interventions, maybe like the music therapy or nature therapy, or technological issues like pill burden management through a drug box. So these are variety of approaches which can be beneficial, or just creating an awareness that rather than just accepting things as an aging process.
When we talk about the elderly, usually we just focus on the mental health issues in the elderly, depression, geriatric depression, dementia, and all. There is also quite a bit of concern that the numbers are expected to grow exponentially over the years to come, especially because our longevity is increasing. It's also the burden of comorbidities like high blood pressure, cardiovascular conditions, or diabetes, etc. They are risk factors. Like, what kind of capacity India needs to be better prepared for these conditions?
I feel training the ground staff, then also generating awareness, educating the people, the caregivers, then sending campaigns in the urban and rural India where related to hypertension, diabetes, and all the comorbidities, keeping a track of the morbidities and maintaining a registry of what's happening in India. Over a period of time, we would be able to predict the trends, and this would help us to monitor uh, or just able to support the demographic transition which is happening. So along with that, we also need to document these, write it to the national and the respective state governments related to how to have the infrastructure or the specific medicines which have less adverse effects, or maybe catering to specifically to the senior citizens. So with this intention and generating an awareness, making them having access through telemedicine or through some technological issues, we could reach the unreached and prevent further generation of complications.
For the audience, this book is quite updated. I found a chapter on COVID-19 in the elderly and adult immunization. So quite updated. And of course, I'll leave a link for the book. So this is the book. And if any one of you wants to have a look at it, the Kindle version is also available. Can go and check. But one chapter that has been missing is research on the elderly in India. Maybe you can add that chapter because it has its own nuances.
Yeah, there is a need for that. So what are your suggestions for young researchers who want to pursue a career in geriatrics?
So looking at aging process not as a normal phenomenon, or not as, so documenting them, clearly seeing what they are going through and addressing the common issues, or maybe it's not that we have to specifically target the core issues, or so any topic can emerge related to. So with the keen observation and identifying the common issues like nutritional assessment, polypharmacy, or maybe the drug interactions, or related to uh, uh, instrumental activity. So social issues like it. So basically observing what's happening in an elderly and picking up the core issues and merging them into the specific settings of India would be very essential at this moment. Also, validating the scales which are related to the non-Indian origin, testing them, doing a pilot study, and putting them across in a manner that they could be catering to the Indian population would be essential. Also, the database and the trends, following the trends, like how we are seeing them in an urban area, what is the trend in the rural area, would be very essential. So comparing them and doing a randomized control trial or so, but there are issues related to the ethical aspects which we need to pay very keen attention, and especially when there is a moderate cognitive impairment or a severe cognitive impairment where they will not be able to give consent. So here it's very ethical issues would play a role. So addressing these proper documentation and putting them across unbiased, the result should be unbiased, then, or what is exactly depicted from the study should be put across. Then I feel the research would be more rich, or it would be truly a strong study, and definitely it would reflect the true picture in urban or rural India.
Very nicely, you have actually put across the uh, key pitch over here. It seems that we need to take up more social behavioral research in the elderly, not just quantitative ones. And there are many contextual findings, and they may vary from different parts across our country. Social norms, behavior patterns, too many things. And of course, the tools, being able to adapt international tools to Indian context, use them with good capacity, document them properly, and of course, being very cognizant and watchful of principles of ethics, um, confidentiality, privacy, autonomy, voluntary approaches, all those things. Like in the IAPSM Young Leaders Conclave, so this conclave was done by MGIMS, Wardha, and in collaboration with Dr. Amit Dias from Goa Medical College and Dr. Ranjan from AIMS Nagpur, with a workshop. And the title was Leadership in Integrated Care for the Elderly. And we found that a systems approach is necessary to move this big rock in any direction we want to. I see that in your book, you have talked about role of NGOs and programs, but maybe if we include a chapter on systems approach or integrated care for the elderly, that again.
Putting them through, like they're here in this age group, we need to put across various platforms. Like we need to put across various organizations, may it be related to the government, may it be related to the private sector, medical colleges, NGOs, voluntary agencies, involuntary agencies, and the ground staff. The most important thing, who would directly be educated and putting across the knowledge or the awareness or the interventions. So the whole team, what has to be most important is monitoring and getting them regulated updated at regular intervals as per the latest norms. So may it be related to various from the grassroots level to the national level, at various sectors. We need to put across resources, infrastructure, then manpower, and also at a regulated approach and monitored approach. So when all of them work and with the use of technology, so that in the COVID era, if we are unable to reach, which is which is expected, that so training them through digital networking or using digital through the digital platform is very essential to get the exact data. So training and majority of the aspects has to be done through training and generating awareness. There should also be a backup team wherein we would want, if there's some at any juncture, feedback has to be taken, and how and what. So basic SWOT analysis of what's happening should be taken every week or maybe a fortnight, which could be better and observed and monitored. So by doing so, we can have a strong database. We could have a strong information which is valid and reliable, and we could put it across. So whatever is there in the nation, in the urban and rural area, we could put it across to specific organizations which would put forward their plans for addressing them.
This book is quite comprehensive. You've taken up issues like intergenerational engagement programs, cognitive stimulation, uh, body donation, end of life care, and so many such uh, topics which we do not actually cover in our academic curriculum usually. So, for youngsters who want to take up a career in geriatric public health, I'd strongly recommend this book because this gives you so much of Indian contextual understanding, so an understanding of the Indian context. Of course, there are many other resources. This domain is evolving in a very rapid manner. The government is also cognizant and is also trying to take some steps. So thank you so much, Dr. Sachin, for coming up with this book, which is Healthy Aging in a Changing World. And yeah, it doesn't have like
Thank
minute fonts. The fonts are good. So yeah, I can easily read through it. And it's about 470 odd pages, 70, 80 pages. So, and move fast. Anything, Dr. Kavita, you'd like to add?
Yeah, I just wanted to ask you, why awakened aging? Like, what was your thought behind the word awakened aging?
So when
Yeah.
we say majority of the negative quotes have been quoted related to aging. Maybe they show a tree which has lost its leaves, or they would show a senior citizen who is weaning in his going through sarcopenia and all his so a lean body. So why not see it in a different perspective? We always have received so much of experience, their values, their from our seniors, maybe from our grandparents or from our parents, or maybe from our great grandparents. I was fortunate to see all of them, and when I see them impart their knowledge, why can't we have another childhood or another aging process? And when we document all the findings under this, why can't we make them this aging a graceful phenomena? And so I decided to put this as a phenomena where we can uh, uh, make them an awakened aging and have this the end of life as something that is which will bring cheerfulness to them when they see their grandchildren, or maybe they see something like this or read something like this. Okay, people do think about us as well, rather than just accepting them as an aging process. So I thought let us put it in a positive way. Even the sunrise here, it depicts the sunrise. So I did put it in that manner as well, rather than putting a dull cover or. So I thought let's put it as a ray of hope, and that's why it was awakened aging and ray of hope.
No, I was saying like it is very important for positive messaging to go across, you know.
Thank you.
Let's hope that the youngsters will be excited to take up geriatric medicine. We need more and more geriatric public health professionals in the future. Because till now, much of our focus has gone after maternal child health, and of course, maybe with the COVID-19 pandemic, some may be stimulated to take up infectious disease epidemiology. But geriatric public health requires some prioritization. And if more and more people could take up this as a career and generate indigenous evidence and insights, because we do not have much evidence from India as well. So, would recommend this book. We will leave all links in the description. Also, the link to Leadership in Integrated Care of the Elderly, that workshop, that recording link will also leave in the description. You can access that. Plus, if there is any resource that you feel that others should access, drop in as a comment. so that it benefits anyone who happens to watch this video. Wonderful interacting with you, Dr. Sachin. Thank you for sparing this time for us.
Thank you, sir. Thank you.